Hi, this is Dr. Bob Dannenhofer. We did a video last week on what to do if you test positive for COVID, and we've been asked to do a video now, what do you do if I'm a contact of a case? So we know that in people who are in contact with somebody with a case of COVID have some chance of getting it. Depending upon how close you are, that chance can be just a few percent to about over 50% of your family contact, with an average of about 20% of the people who are contacts wind up getting the disease. And so a lot of it depends upon how close you are to the person, how long you were with them. In a household, it's really, really hard to isolate yourself from somebody who's sick because you're sharing space and you're close for a long period of time. In a workplace, the closer you are and the more contact you have, the more risk you are. And we think that that risk, there's no absolute dividing line when you become a risk, but we think if you're within 6 feet for 15 minutes, whether or not you're masked, your risk is increased. So that's kind of where we set the guideline, but very clearly it's not a sharp fall off. We know some people have gotten the disease when they've had less than 15 minutes exposure to a case, and then we know of others that have had very close exposure don't get it. But in general, if you've had more than 15 minutes exposure with less than 6 feet, more than 15 minutes for less than 6 feet, with somebody with a case, that you have an increased likelihood of getting the disease. The incubation for the period of disease is anywhere from 3 to 14 days, but we're really seeing now that it's really 4 or 5 days. So 4 or 5 days after you've had contact with someone is the most likely time you would expect to get symptoms. We are trying to call everybody who's a contact to let them know that they're a contact and they should take precautions, but this sometimes falls apart. It falls apart for a few reasons. Sometimes we can't reach the case themselves, and thus we can't find out about the contacts. Many times we reach a case and they're unwilling to talk to us or unwilling to give us the name of any contacts. And without them giving us your name, there'd be no way to know that you're a contact. And sometimes people forget about contacts. It's truly remarkable when we talk to people and ask them about their contacts, and no, I haven't had any contacts at all. But when we dig deeper, we find out they had lunch with somebody the day before, they were exercising in the gym with somebody the day before that, and those would be the issues. So you may not get a call, but you may find out in other ways that people you're around are positive, either by social media, or maybe they give you a call and say, hey, I know we had lunch yesterday and I tested positive, so I think you're a contact. So what should you do? So if you're a contact, there are a few things that we would have you do. The first is stay home. So if you're a contact of a case, you should stay home because there's a chance you're going to get the disease. And if you go on your daily duties, which is go to work or going to school or whatever else, you could infect others. So the first is stay home. And that staying home when you're a contact of a case is called quarantine. Quarantine is an old-fashioned thing that we've used for many, many years to protect people from disease. And on that quarantine, we would have you stay home and try and not infect others. Staying home would mean not going out to work, not going out to the store, not going out other places. If you're at home, you have the decision about whether you would quarantine with your family or apart from your family. But again, staying home is the number one thing that we do. Second thing we would have you do is monitor for symptoms. With COVID, there are lots of different symptoms. Some people have nausea, vomiting. Some people have fever. Some people have cough. Some people have runny nose. Some people just have fatigue. Some people have a combination of those. All of those are pretty non-specific, and many people early on in the disease think it must have been the smoke, or it must have been the allergies, or it must have been a cold that's coming on. But again, early on, it's not very obvious. The only symptom which is really very distinctive for COVID is a loss of sense of smell or taste. And so if you have a loss of sense of smell or taste, that is pretty specific for COVID, and you might have it. How long should you quarantine? Well, there's a lot of options. The safest option is to quarantine for 14 days after the last exposure. So you might have an exposure with somebody at work for many days at a time. It's the last day you were exposed to them, and you can quarantine for 14 days after. You don't have to do any testing or anything else. You could just do 14 days, and at the end of the 14 days, if you're well, the chance that you could spread it on to someone else is very, very small. Second way to do it is to quarantine for 10 days, and then monitor yourself very carefully for the next 4 days, for a total of 14 days. Or the third option, and this is the option which I think is very popular, is to quarantine for 7 days to get a test. If you're feeling well and the test is negative, then you can go back to your regular activities. That gets you out of work or out of school, whatever, for a week, and provides a lot of protection to the people around you. Now, there are some complications here. If you're in contact with somebody who continues to be sick, the quarantine time may be longer. That's always a concern. The other thing that comes up is people sometimes need a note to get them out of school or work. We at DPHN can provide that, and if you call our hotline at 541-464-6550, we can go ahead and get you that note that will keep you in quarantine. In addition, we can provide services for people in quarantine. So some people say, geez, I can't be in quarantine because I don't have a week's worth of food. We can help people get food. We can help people get other kinds of things to help them in quarantine. Right now, the number of people in quarantine is enormous, and so we're not able to provide the same level of service we were early last year when we had 50 or 60 in quarantine. Now we have well over 1,000 in quarantine, but we're still trying really hard to make it easy for people to stay in quarantine. We're in a terrible surge right now, but again, if people are in contact, stay home and stay in quarantine. People who are sick, stay home. We can really knock this back within as little as 2 weeks. Because remember, incubation period can be 3 to 14 days, but usually around 5 days. So between now and Labor Day, we've got about 15 days. And if people really did this, we would have 3 incubation periods, and we could really knock this back. So please, if you're a contact of a case, stay home. If you have questions, call us at the hotline at 541-465-6550.